Always suspect renal, bladder, or urethral injury if a patient complains of hematuria. These injuries are typically the result of blunt force trauma to the groin. Symptoms from the history can be a big clue as to where the injury lies. By the end of this lecture, we should be able to describe renal injury, describe bladder injury and its types, and describe urethral injury and its type. Renal injury typically presents after direct force to the flank region or from lower rib fracture punctures. The patient will have bruises, flank pain, and hematuria. Bladder injuries can be divided into dome injuries and anterior wall injuries. The peritoneum is an important landmark in this region. The bladder itself sits below the visceral peritoneal cavity, or subperitoneal, but its superior surface is covered by visceral peritoneum. Key question for the clinician to be asking is the urine draining intraperitoneally or extraperitoneally? Superior bladder wall or dome injuries typically present after a seatbelt injury following an MVC. Since the dome of the bladder is the weakest point of the bladder, especially if the bladder is full at the time of the accident, the increase in pressure from an abrupt stop may lead to rupture. Dome injuries that rupture the overlying peritoneum will lead to fluid extravasation into the peritoneal cavity, or intraperitoneal. Anterior wall or neck injuries typically occur after a pelvic fracture. Bony spicules lead to a bladder tear and leads to an accumulation of urine in the retropubic space, which is outside of the peritoneal cavity, extraperitoneal. Urethral injuries can be divided into anterior and posterior injuries, with the dividing line being the inferior edge of the urogenital diaphragm. The anterior urethra is made up of the spongy or penile urethra. The posterior urethra is made up of the membranous and prostatic urethra. Anterior urethral injuries commonly occur from perineal stratal injuries. Although you may have laughed at all those YouTube videos of skateboarders landing groin first into a hand railing, you probably have never thought about what happens to them 30 minutes later. Well, they end up in the emergency department with pain, fullness in the groin, inability to urinate, and blood at the meatus. This type of injury typically affects the spongy portion of the urethra, as we see in this diagram. If this structure is ruptured, then there can be an accumulation of blood in the scrotum and urine can escape into the perineal space if Buck's fascia is torn. This would present with a scrotal hematoma due to all the blood and urine pooling. Posterior urethral injuries typically occur from a pelvic fracture and affects the membranous urethra, as we see here. Here, we will have an accumulation of urine in the retropubic space. This would also present with blood at the meatus. But on physical examination, a high riding prostate would be a big clue, since all of the draining urine would cause the prostate gland to buoy up toward the bladder, as we see here. You'll notice that there is some overlap in the injury presentation with bladder injuries. It is a tight space. Alright, flash quiz. Which genitourinary injury can lead to increased BUN creatinine ratio? Superior bladder wall or dome injuries. Remember that this leads to urine accumulation in the intraperitoneal space. In this video, we learned that renal injury presents with hematuria and flank pain. Bladder injuries can be divided into dome and neck injuries and lead to urine accumulation in either the intraperitoneal or extraperitoneal space. And urethral injuries can be divided into anterior and posterior and present with blood at the urethral meatus. Thanks for watching, and be sure to click thumbs up if you enjoyed this video.